This year's Uganda Human Rights Commission report included a new aspect, the quality of food in Uganda, amongst other human rights concerns. One of the arguments fronted in the 266-page report is that food safety regulation in Uganda is now lax. It presents evidence of adulterated foodstuffs like milk, meat, and cereals.
Farmers and all value chain actors should ensure good agricultural practices such as timely planting, timely weeding, adequate pest and disease control, proper harvest and post-harvest handling practices along the value chains, all to ensure quality.
Food rights advocate Agnes Chirabo says this can lead to devastating effects.
It's true that one needs not to labor now to clear the world using militant machines. It is about dealing with food. And actually, we have information that the new terror is going to be through food terrorism.
In 2005, member countries of the Global Health Security Agenda, in a bid to mitigate the impact of naturally occurring outbreaks and accidental or intentional releases of dangerous pathogens, member countries drafted an action package to spur full implementation. They include prevention, detection, and response. Uganda is prone to disease outbreaks. It is vulnerable because it is located within geographical belts for yellow fever and filoviruses. Moreover, it is located close to the Congo Basin, one of the world's hotspots for zoonotic diseases. To combat these threats, in 2013, Uganda joined the Global Health Security Agenda. Later in 2017, Uganda became the first African country to host a high-level ministerial meeting of the Global Health Security Agenda, signaling Uganda's ongoing political commitment to this effort.
For us as a country, definitely we have built capacity of the village health teams. We have built capacities of the various health workers at the community level. We have national task force. We have district task forces, and all these really help us with, we actually using this to actually improve on our own capacity to deal with these emerging threats of diseases, especially the infectious diseases.
International monitoring bodies, including World Health Organization, Food and Agriculture Organization, and the Organization for Animal Health, working together, formed the One Health strategy to implement the agenda. Technical experts have since adopted the guidelines formulated under One Health. Professor William Bazeyo is an occupational health physician at Makerere College of Health Sciences. He says the college has developed curriculum on One Health.
We have trained many people at different levels. We have trained people pre-service, in-service, and the communities on some of these issues. We have seen ourselves control diseases like Ebola, rabies, and the foot and mouth disease using the different disciplines working together. We have also generated modules that will now be used for sustainability purposes, for training people in universities. We have been able to strengthen some of the laboratory training through the One Health workforce.
You recall what happened? We had to run around to establish what was wrong with the food aid supplied in Karamoja. It must be so fast because the impact is so fast. So we need to equip our institutions technologically. We need to equip them with the relevant human capacity that serve to purpose, but we also need to equip them financially.
State Minister for Health, Sarah Opendi, says they are working towards linking public health with law enforcement.
Of course, we have the Public Health Act. It's currently being amended, but I must say that generally the communities in Uganda have been really very cooperative. And when there is a challenge, even in their farms at individual level, they have been quick to report.
We have, as One Health Central and Eastern Africa, engaged other different partners like the Department of Defense when we are looking at biosecurity. Biosecurity Many people don't take it very serious, but I think it is one of the most dangerous and serious issues that one needs to look at. We have worked with the Department of Defense in training our students, in training the in-service workers on biosecurity.
Several countries in Africa have developed specific tools and programs that can be tailored to build capacity and address country development needs.
In Cameroon, the biosecurity and biosafety process is also supported by a series of laboratories carrying out activities such as the detections and the monitoring.
However, Professor Bazeyo says some countries are stifling the progress.
This is more political than being technical, where it is seen that when you talk about security, you are talking about their armies, their police, and so on. Leaving the fact that biosecurity is actually a human threat. Pride within the different institutions. I own this curriculum. I do not have to be instructed by another institution.
If we need a stable and secure population, stability and security of people starts with the security of what they are eating.
Walter MWESIGYE, NTV.